Hygienist and Young Dental are really good. They're a good pair because Young products for hygienists are of very high quality. And I feel really good about sharing those products. So are you guys familiar with Young products? Does anybody use any Young? Young has been around for 100 years. All of their products are manufactured in Missouri, in the United States, so I'm proud of that too. On your table, there are some flyers. There's our quarterly flyers. We have specials every quarter. And so please take this back to your office, take a look at it. One thing, if you use any Young products, one of the specials right now is 1,500 of the Young disposable angles will get you one of these awesome Hygiene hand pieces for free. And you do have my card in your bag, so if you decide that if you're using Young products and you want to stock up on your disposable perf angles and take advantage of this offer, just let me know, because you won't have to mess with invoices and everything. I can just order it for you, but I'll be happy to pass this hand piece around. It's every hygiene product that Young makes is made with lots of input from hygienists. So they are looking for your input, and many of you already signed my little form, which I appreciate very much. But Young will send you a survey about the products that if you answer, you'll get a $5 Starbucks gift card. So is there anybody that didn't sign that wants to? So we're passing around the handpiece, which is awesome. It has a lot of great features. The textured nose cone, so you can hold on to it. You can see it was very lightweight. It has a little reverse radius that fits in the crook of your hand, and the attachment is contra-angled, so you don't get as much cord drag. So it's a really nice handpiece, and it is especially made to use with disposable perf angles. And the Vera, which I don't have any samples of the Vera paste or the Vera angles, but has everybody heard of Vera, or anybody heard of the Vera? I didn't know, but Vera actually it's an acronym for visibility, ergonomics, reach, and access. So they're smaller. They actually have screw-in prophy cups, which is the only disposable perf angle with screw-in prophy cups. They're very nice. And I wish I had some to share with you tonight. But if you would like some of those samples, if you want to put a star next to your name on the
we're thinking about taking this actually. We can only use very old equipment.
You know, it would be so awesome if I had a sample of that for everyone. So are you done with that now?
Yes, you better take it.
Thank you. So one nice thing about all of you'll find a flowery pack, thank you, of Prophy paste, the Delish. Has everybody heard the Delish line? All of Young's Prophy paste, the Delish, the Vera, and the Smart Select, which is what Laura was talking about. They're all gluten-free, and they're all sweetened with xylitol, and they all have fluoride in them. So those are all good things. And the thing about the Delish is it has 15 flavors to pick from. So it's creamy, doesn't splatter as much. Also in your package is the Smart Select paste, which is a 2-part paste, and it's super nice. It has a darker stain removing section, which Patty was saying how, the pre-polishing, it's a really good one for pre-polishing. And then the lighter color is a fine polishing paste, so you have a nice smooth surface, so you can go back over it with that. So try that. I think you'll love it. I love it. And finally, the last thing is the Delish varnish. Has anybody tried the Delish varnish? It's delish. And actually, their newest flavor is vanilla cupcake, which people seem to really like. And you'll find it goes on smooth and clear. It's not as clumpy. It's not clumpy, and a very nice brush in the package. But the company has indicated their research that you can actually drink hot beverages after placement. So unlike the other ones. So any questions on any products? Try them. Let me tell you. Call me if you want me to come to your office and share with you. If there's something you really love and you want to try to convince if you're not already using it. appreciate your time. Thank you. Thanks for having me. Did anybody else need that? Thank you, Abby. Thank you.
Does anybody want to get more food or anything? Yeah, we made them. So make them up. Oh, you can. Daniel.
And I just threw those back down. Thank you.
Want one?
Sure.
I can give you the link. Okay, so Tammy's pretty great, huh? It's pretty interesting to talk about. We're gonna kind of slip through these slides. Only Sean probably is the only one that doesn't know about dental hygiene excellence, but we are a coaching company, dental hygiene coaching company, and you probably did look at the website and stuff to find us, right? So our purpose, we always say, is to help others. We actually are both hygienists, as everybody knows, and we just really felt like, you know, hygienists need help. And being a hygienist ourselves, we were like, okay, we put this program together to help people to get the team effort going together and just a happier hygiene experience every day. Our passion has become the oral systemic movement. We are just so excited about the fact that oral health has so much to do with systemic health, and we have been going to AOSH and learning so much from all these people that are making a difference across the country. And that's what our mission is to make a difference across the country in dentistry, and link that oral systemic link in there with our care that we give every day. And most of all, we want to have some fun. So I hope we'll have some fun tonight. We have a small group. This is the hands-on portion. So I did have a introduction for Tammy. So there she is with her husband. He is actually an orthopedic surgeon, I think, or something like that. So they're both in the medical field. We are very big advocates, I suppose, of all of these companies. We don't make any money from any of these companies. We do make money from Juice Plus, and I just wanted to say, Tammy had brought Juice Plus up a little bit, and we actually do use Juice Plus because it has such wonderful research. We do actually put it in our perio program, just because we feel like, you know, our patients are sick sitting in our chair, patients are fighting inflammation, and the whole food nutrition that's in those capsules, there's a lot of really great study about how it, well, actually there's a perio study, there's a third molar study about how much better people heal if they're on some whole food nutrition. The immune system is so much stronger, and that's what we sometimes do when we do an oral DNA test and our patients have high bacteria, and we actually get it down, but there's still some bacteria under the threshold line. So what has to happen is the patient has to heal. They have to fight that bacteria and keep it down below the threshold. So we give them something to help their immune system. So like I said, that there's just some really good research about systemic inflammation and healing. So we are advocates of Juice Plus. So that's the only company that we would make money from, and we do put it in our practices. If you want to offer it to your patient as a hygienist, then there is some, you know, a small business that you can have with that. And it's usually like the doctor's on top, and then you're under the doctor or something like that. So it's a really nice way to incorporate that into the practice. I know that you guys have heard Dr. Doneen. Some of you have heard her. This is a really short video, and it's just, I just love her so much, and she is all about the oral systemic connection. So I'd just like to play this for you. Of course, you know, technology usually work. So you just tap on it?
Should be able to just tap on it.
Yeah, well, not so much.
It's like mine last month and doesn't have any volume.
be able to just be so easy to have all these things, this technology. It's great when it works, and it's not when it doesn't.
We're an easy bunch.
Yeah, right, there's only 5 of us, so
Yeah,
we're
we're
good.
good. I'm not sure how we have a whole lot of us.
Well, that's okay. We can skip it. It was just a short video, but she is actually, in this video, giving a call to action, especially to hygienists. She really wants, as a medical doctor and a heart attack and stroke prevention doctor, she really wants us to help, and all the doctors that are involved with AOSH want us to help them screen our patients. So it's kind of what we're going to be talking about tonight a little bit. I wanted to talk about certification for the DHE method. You guys who are coming every month will be certified at the end to in the DHE method. So what that really is going to mean is that you come here all year, you've learned a lot of things, and now you get a certification for it, which is great, right? Put it on your wall. Patients know that you've been learning and working all year to be the best you can be. So there will be a certification. And then what you have to do is present a full case utilizing the 14 steps. So it's just a story. You'll tell a story about your patient, starting with step number 1, what we found out in the phone interview, all the way to getting the patient scheduled. So it's just going to be your story about a patient and implementing what you've learned through the year. Anybody have any questions about that at all? Okay. So today is the hands-on. Julie did a great job last month. I was not here because my friend's husband passed away and I had to go to the funeral home that night. My aunt actually passed away Tuesday, and I should be in Kentucky, but I wasn't about ready to do that to Julie again. Oh yeah, she's like, okay, well, I mean, she's 96, and so I didn't go. But anyway, so tonight's the hands-on. So in your handout, we have again, from almost the same as last month, really, the handout has the hygiene appointment checklist, which we want to look at to make sure, what are we actually trying to work into our appointment, which is more and more every day, right? The hygiene appointment gets more complex all the time. And then the time study is in there again. Did anybody do a time study from last month? That was kind of what people weren't here, obviously, who didn't, but did anybody try it? Did you guys, were you here last month? No. Okay, no. You weren't here? Okay. Jennifer, you were here, weren't you? Yeah. Did you do it?
Yeah.
You did? Okay. All right, great.
Necessarily did it.
No, and you didn't have to. That's the thing. We'll talk about that in a minute. But anyway, tonight what we want to do, there's a focus sheet, a page in there that's the focus sheet, the airway form. Then I've just given you your laminates of your periodontal, the levels of periodontal disease. And then that tooth chart is the level of dental disease or tooth disease. And then we have some of the research on Juice Plus, if anybody's interested in that. We also have Juice Plus back here to taste, so we can do that as well. This is actually, if these would play, it'd be awesome, but Dr. Bale actually talks in this video about the standard of care. And he says the standard of care is actually just, it keeps us out of jail. I mean, we just barely practice to the standard. And sometimes it's because our appointments get too chaotic. We are trying to do too much, and we don't have enough time, and we get behind, and it gets chaotic. And so we just barely kind of keep our practice above the standard. And he talks about the standard, that we will never be held to above the standard because it's just too difficult to even legislate. So, but we want, as hygienists, we want to practice above the standard of care. So step 4 is the WOW experience. We talked about it last month. And the goal is to create a WOW experience for the patient so that I actually have had the patient sit up in the chair and say, wow, I've never had an exam like that before. So in fairness to our colleagues, we know that they have, but if we don't let the patient be involved and participate, sometimes they miss some of that, and so we're doing a lot that they don't really know about. We do want to, with doing all of this, we want to be practicing an elevated standard of care. We want to improve our time management. We want to make sure the patient values their treatment by the end of the appointment and actually schedules for their treatment. And we are creating a lifelong relationship. When we spend the time with the patients and they really, feel that they can trust us because we're telling them the truth and they're understanding what they need, then it creates a great relationship. So tonight, what we're going to do is we're going to work on how do we do all this in one appointment. Jennifer, what did you find? Do you do most of the things you feel like in your practice that were on there?
We do, and we do things, but just in a slightly different order.
Right.
So for me, I was trying to kind of rework how we already did things to get everything, in the time test on, accomplished, but just in a different order than what I'm typically used to. So we kind of do a red reading in our office. So I see my patient, we go over the medical history, and a lot of these patients, though, I've seen for a long period of time.
Right.
And, well, my kids are doing this. And so you're trying to go through all of that and, still keeping that relationship going. What we'll typically do is do all of our screening initially very quickly, not quickly, but you do your period chart, do your integral, photos, do your radiographs, do all of that right away, any chief complaints. And Dr. Nance has it down, she wants us to have that done within 15 minutes. So we have a very small office, but she's in and out of rooms. So we'll typically put a note on her back counter that we're green, meaning come in whenever you're ready, whenever you can.
Anytime exam.
And whether it's going to be long or short, and we always put the time, so she knows, if Chris puts hers in there first, then she goes to Chris's room first. But we get everything in, it was just in a slightly different order.
Right.
So.
Right. And that's part of it. That's part of the time study is what order works best for me and how can I, stay on cue with that. So that's definitely part of it. So thank you for sharing that. So we feel like that, we know our patients learn by visual. They like to be taught with pictures. And so we have some of these things that are implemented into this whole hygiene appointment that help them learn. There's pictures, there's things for them to fill out, there's things for us to go through that make the appointment faster and also with a good outcome the patient actually can understand. And I say go out of the appointment and tell a story. Can your patient leave the dental office, go home to their spouse, and when the spouse says, what happened at the dentist today, and they can actually tell a story that makes sense. Most people go in, I don't know, they want to do a crown, right? I got my teeth cleaned, they want to do a crown. They don't really understand, so that's part of, just really making sure that they value because they understand, and they can actually go home and tell the story. So tonight what we're going to do is work on these few things that are visual learning tools, and they also, for you, are time management tools. So we're going to go through each one of these. So your time management, your time study, maybe won't be in the same order as we have it here, but it's okay to do that because you want to figure out, how efficient am I? Because if you're working next door to another hygienist all day and maybe you're running a little bit more behind than they are, you wonder why. It's like, why does she get all this done? So this time study, when you actually write down how much time you spend, it actually tells you how effective you are, how efficient you are. And what services take the most time? Some days, honestly, I take a full mouth X-ray and I catch myself just being so chatty. But you're standing there holding the film forever, getting ready to put it in their mouth, and they're talking to you and you're talking to them, and that can't happen all the time. You have to, like you said, we want to keep the relationship going, but we can't take a lot of time with the chatting. And then what is the order? What order makes sense? So our order doesn't really make sense for you, but if you just flip it around and keep that same, interval of time, that's perfect. But you have to know that. And then what tools help with the time management? So that's what we're going to do tonight is work on 4 tools that help you with time management. And then which services could be delegated to an assistant? Which of you guys have an assistant? Anybody? You do? Okay. So some of the things that you have to do, then you could actually get your assistant to help you with more. Right?
Yeah.
Maybe, if you can find her. Okay. So which ones can be delegated? And then how long does it take for the doctor to do a thorough exam? Sometimes the doctors get kind of chatty too, right? So step 7 is the hygiene-led exam. So we will be going into that too. When the doctor comes into the room, how can you keep control of the exam so it doesn't take all day. And so it's not, and in fairness to the doctor, so it's not a scavenger hunt for them. You know, we've been in there for 50 minutes, and sometimes, honestly, we see hygienists still today will leave because, hey, I gotta go to the bathroom. This is my time to escape, you know, and they leave the doctor by themselves. And so we say that's a scavenger hunt for the doctor, and it's not really fair to the patient or the doctor. So, you know, how long does it take them to be thorough? And then how can we get the doctor's exam done more thoroughly, more efficiently? So that sounds like your red-green thing is good, especially I like the thing about putting the time on it, because that's awesome, because a lot of times our doctors are like, well, I just go to whoever. Now, we sometimes work with who has the biggest treatment plan. You know, like if I'm going to present a lot of treatment and you have a child, then maybe she would want to go to you first, get that over with, and then come to me because she knows it would probably be more time consuming.
Yeah, we do long, short, so.
Okay.
If I have a new patient that, if I know that it's gonna be an extensive exam, I'll write green, and then I just write long.
Okay.
And so she knows it's gonna be a longer exam. She'll also look and see, you know, if there are openings or, you know, if there's a few minutes after my patient and Chris doesn't have that, then she'll make sure she goes into Chris's room. In theory, she will make sure she goes into Chris's room first so that we can try to keep things moving. But we try to let her know before she even comes in whether or not it's going to be a long or a short exam.
Okay, those are good tips. Would anybody else have any ideas
We
with
use
that?
a software program called Blue Notes.
Okay.
Do any of you guys use Blue Notes? Messaging system, big office that I work at, and we kind of do things, we like to have things all done, like ready for the doctor to come in 15 minutes into the appointment like you guys. So we don't have to get out of the room. It's super efficient. We just stay in there. It's like a messaging system throughout the office. I'll put the patient's name, age, if it's long or short, any specific like chief complaint stuff. And then we've got 2 doctors there usually. They'll see, and as time lapses, it'll be like green when you first send it. And then say it's been out there floating for 20 minutes and the doctor still hasn't been in, it'll turn yellow, then it'll turn red if they really haven't been in.
And they're in a lot of trouble by that.
I love it. We used to do the whole like the piece of paper and hope that the doctor sees it, basically.
Right.
Changed everything.
Blue Note.
Blue Note.
I've heard
Do you know about Blue Note?
I've researched it. I've heard good things about it. It's very specific to what it does. It's like $800. It's not, so it's right around for a busy practice, it could be worth it. For us in our 4 ops right now, wow, it's been $800. I've been trying, but to be honest, I've been using other alternatives, trying to not spend the $800, and none of those have been working. So.
So that's what we have to kind of ask ourselves sometimes.
Yeah, we're looking into shock collars.
I've wanted to do that for years. Yeah, I think all dentists need a shock collar at some point, right? Okay, so the first one that we're going to talk about is the focus sheet. Now, the focus sheet is something that we like to use on the first of our appointment, and it's kind of like it takes the selling out of it. You know, we have so much to offer our patients that if we start to say, are you interested in whitening? Are you interested in ortho? Are you interested in, that it sounds like we're trying to sell them, and I get that. And we do hear that from patients, don't we? That, oh my gosh, all they want to do is sell me something. So the focus sheet is, part of that is to take the selling out of it. Because it's actually sort of a menu, if you will, of services. It's like what we have to offer. And then it's like putting things out there for the patient that maybe they desire, maybe they'd like to have done, but we haven't really uncovered that. We don't really know that for sure. And so it triggers their memory. Maybe they've seen something, read something, maybe a friend has said something to them, or it might even trigger a referral. Maybe it's something that they would see on there that one of their friends, their spouse, their child, somebody else would like to have, but they didn't know that we did. So if we don't tell them what we can do for them, then some things like this happen. We had a practice out in West Ohio, and the doctor had a patient who came in and had full mouth rehab, beautiful rehab all done, And he about had a heart attack. When he saw her, he was like, what did you do? And she said, well, I went to Florida and they made my teeth beautiful for me, like my friend had done. And he was like, we could have done that for you here. It was like a long-time patient. I mean, he was crushed. But you know what? She said, I didn't know you could do that, honey. So nobody had ever asked her, is there anything you'd like to change about your smile? Nobody asked her the right question, and she didn't know that they did that. Some have done this for 20 years. Sometimes it's, a friend told me that her dentist does this. Do you guys do this? They shouldn't really have to ask us that kind of question. They should know what our services are. And then maybe I read about something in a magazine. You guys don't do that, do you? So, if we don't tell them what we can do for them, then they may go somewhere else to find something. So, we like to start out with a good question. We don't want them to forget of what they came for if they have something special. How many of you have made a list for your doctor, gone in? I make lists in the car. First, I forget the list. But, it just doesn't seem like the right time to drag out a list and start asking questions when they're obviously, over their 9 minutes with you at the time. So we like to ask the dental patient, what is your long-term goal with your teeth? How can we help you reach that here in the practice? And sometimes the patient kind of looks at you weird, like that is a weird question. But it will bring out my long-term goal. Like my long-term goal is I never want another root canal. Never. I won't have one. So that's my long-term goal is I want to stay healthy enough that I don't have to have another root canal. So you hear really, specific things. Some people say, well, I just want to keep my teeth. But some people say, oh, I really want to stay healthy. Or I really want, I would like to have straight teeth, but I have to win the lottery first. But when we know that they desire these things, then we can help them get to that point. So that's what we tell them. We would love to help you here in the practice reach those goals. So we have so many services to offer you. Is there anything on this list? And if you look at your focus sheet there in your packet, is there anything on this list that interests you that maybe sometimes we don't talk about that you would like to actually ask a question about? So this is what the focus sheet looks like. We have many versions of the focus sheet, but basically, we tell them that, we always look at your teeth, your tissues, your bite, your airway, and we always talk about the oral systemic connection. But is there anything on this list that interests you that you would like to focus on today and ask the doctor or myself about?
This opens the door to so many avenues. And are you having any issues today? Like, of course, everyone's going to say no, and then halfway through the appointment, or sometimes at the exam, they say, really been having some sensitivity over here. So this sheet's great. Just for pulling out stuff that people forget about, or they think it's not really that big of a deal.
I like that health history question. Didn't they change your health history?
Yeah, they're on
That's my
autopilot.
heart attack.
So we have to take them off autopilot. Do you
Do
guys, do any of you use anything like this? Have you had anything like this?
We use it at one of my offices. We have a focus sheet there.
Okay. And how do you feel like it works?
When we use it, I feel like it works well, but it doesn't get executed all the time there.
What's all the time? Like, do you use it half the time?
Probably.
10%?
Probably half.
I feel like it's just one of the biggest time savers. Just like Patty's saying, if I have a patient come in, you say, right, is anything bothering you? They say no. Okay, well, what are you going to talk to the patient about? We really want to be patient-centered. And so you're either bringing up what you think, but this is actually switching the table on you. You're now opening the door and it's what they think, what they want to talk to you about. And so then you can just narrow in your focus on that, and that's why we call it a focus sheet, so that you're taking your focus to them and not to the million things that you're like, okay, am I going to talk about whitening? Am I going to talk about Invisalign? Am I going to talk, you're just rambling, like Patty said, you're like going down the list. It's a huge time management.
And again, I think it just, doesn't seem like you're trying to sell them something. They've actually asked for it. They have said they're interested in it instead of you bringing up something that maybe they are, maybe they're not. So in your package there, I have a sheet for you to actually write down. What would you say to your patient? What would be your introduction to the focus sheet? If you had a focus sheet to hand to the patient, what would you say to them?
I do think that's one of the biggest obstacles is figuring out, like, what you want to say and how you personally would say that to someone, because how I say it is gonna be different than how Laura says it or you say it.
Right.
But just, I think really, like we do, actually, believe it or not, we do cover all of these areas, because so many people are like, oh, I just need my cleaning. Well, this is, really, we're doing all these things, and what would you like to focus on? That way it doesn't seem like, it's that short and sweet.
Right. And I love the story about, the last thing we want you to do is leave here, forget something that you really wanted to talk about today. Maybe it's something you've read about, or you had it on your list to ask us about. So we don't want you to forget, to let us know what it is that you would really like to talk about today. So I'd like for you to just take a few minutes, think about it, and write that down. You have a sheet there. Just write down, what you think your intro would be for that, or what you think the value would be for it.
So in business, we call this, your 30-second elevator speech. You're gonna have this 30-second elevator speech about a focus sheet, about a laminate, about periodontal disease, about decay. So it's kind of like that kind of basis. How can you get that down in 30 seconds or less to a patient? Asking them that question.
Just take a couple minutes. So Julie, what's your favorite introduction? What do you say? How do you present the focus sheet?
Yeah, I just, when I sit down with my patient, whether they're new or existing, I really just say, what brings you in today, especially if they're new, what brings you in to see us today? We have you scheduled for your cleaning and checkup, but is there anything you'd like for us to focus on? We actually don't use a focus sheet in our practice currently, but I still feel like I'm going through things pretty thoroughly with them, but just verbally saying, what is your long-term goal with us? Is there anything you'd like to say, change about your smile? And I think most people do respond like, oh, I'd really love to whiten my teeth. I'd really love to look into Invisalign at some point.
So you're asking the question.
Right.
The right questions.
Right. Instead of having them fill out a sheet. I do think most people probably would respond more to using a focus sheet.
Lindsay, what do you think, why do you think or what percentage of the time do you feel like you do use it, since you're supposed to be using it, right? Yeah. Is your name Lindsay?
No, it's Jessica.
Jessica?
Yeah.
Oh, I'm sorry.
It's okay.
You look like Lindsay, the other girl. Okay, I'm sorry.
No.
Jessica.
Well, we usually, ask them about the medical history changes, and then we hand them our focus sheet and just ask them to circle, take a minute to look over this and circle if there's anything that you would like to take extra time to cover today. That's kind of how we do it.
Okay. And did you get good response, or?
They usually just, every once in a while you get someone to circle something, but the ones that they have at this office that I work at is, they're not laminates, so each person gets like their own sheet,
Right.
and if they don't circle anything, you just kind of put it back in the file, but.
Okay. Okay. So that's the focus sheet, and then the next thing that we're going to use is about sleep. So how many people are involved with some kind of a sleep screening in your practice? Anybody?
We're trying to.
Okay.
And we have a monitor that we
Okay.
purchased that we can.
Pulse
send
ox?
the patient. Yeah.
Okay.
Send it to them,
Okay, super. So why would we screen for apnea? You know that it's affecting 18 million Americans, and 90% of those people don't know it. And we certainly know that it drives inflammation. So the hypertension is up, there's heart disease risk that's up, stroke, diabetes, and of course periodontal disease is another inflammatory disease that not being able to breathe at night it drives that even more in our body. So we are in the mouth, we're looking at a lot of characteristics, physical characteristics, Most of the patients that are affected are men over 40. So the male over 40 that's actually obese. The neck size for a male is 17 inches and for the lady is 16. Female is 16 inches. So those are just things that you start to look at, and then when you take your intraoral photos, you may see that the airway is pretty small, especially when they're laying back and their tongue is falling back, which is where they are when they're sleeping. So small airway, narrow palate, we have sometimes see tori because people who can't breathe are clenching. The tongue seems larger because maybe the teeth are malaligned, so the tongue does seem like it's bigger. And we'll see scalloped tongue because the tongue doesn't have anywhere to go except to right up against the teeth really hard all night, or all the time, I suppose. And so we start to see the scallops in the tongue, and of course just the interrupted sleep. So when we give them this form, it's got those questions on it. Some of it's about their medical history, some of it's about the medications that they take, some about just the habits that they have. Are they getting up at night, going to the bathroom because they're not asleep? Or are they waking up tired? One doctor said, my patient was going to bed rested and waking up tired because they just weren't getting the rest that they need. So we are seeing these people, we are seeing these symptoms all the time. So this form actually asks about their habits, about their meds. It looks at their neck circumference and the height and weight. That tells us if they may be obese, slightly obese or very obese. And then these, how likely are you to doze off during these things during the day, which is just sitting and reading, watching TV, sitting and talking to someone. Have you ever been visiting with a friend and they're like getting all sleepy on you? In the car while you're stopped at a traffic light. I know in the Stay On movie, the character in there was like, yeah, I was sitting at the traffic light going to sleep. People had to honk at me to move because I'm just so tired during the day. And it's not funny. I mean, there's a lot of accidents that happen because people are so drowsy during the day. But, just lying down for a little rest in the afternoon, are they going to sleep? Sitting quietly at lunch. We know after some CE courses we eat, then we get sleepy, right? And then when we look at our intraoral photos and compare it with this chart, this Epworth chart, it's like, class 1 is pretty open, right? I mean, they got a hole back there. But then class 2, they're closed about half, class 3, almost to 2/3, and then class 4, they really have a throat full of tongue. And we see these people in our practice every day, right? So this is something that we really want to take on. I think a lot of dentists are sort of dragging their feet a little bit because they're not sure what they need to do about it. Sometimes we don't want to know, we don't want to, face something unless we're real sure what our protocol is going to be for addressing that with the patient. So we know that going to getting a medical diagnosis is pretty imperative. And you can do the pulse ox. We have a lot of practices that are doing the pulse ox, and then that's pretty much just a screening, and then they usually have to go get the real diagnosis for that. So we can certainly help those patients with a oral appliance if they do come back and don't have a medical diagnosis of apnea and need the CPAP. So that's another thing.
We have something, I took a couple courses with Dr. Metz, and was really intrigued by some of the things that he had to say as far as children. And I had a 15-year-old the other day who was a class 4. I had to sit her up to manage to depress her tongue enough to even see. Her uvula was the biggest uvula I've ever seen.
How long?
Her tonsils were almost touching. And her mom kept saying, her breath is just so bad. Even after she brushes her teeth, we can't figure it out. She had no gastric issues, anything like that, no reflux issues, good oral hygiene, and I couldn't even depress her tongue enough while she was laying in supine to even see her throat. So I had to sit her up, and we finally got back there. So we've been referring, kind of recommending to parents even to have tonsils evaluated because there was a shift with medical philosophy over probably the last 20 years, and they said that a lot of kids are not being referred to have their tonsils evaluated if they don't have a certain number of instances of tonsillitis or Xray. And the unfortunate thing is we have these kids
They can't breathe.
They can't breathe.
Right.
And my son was one of them. so I took him on my own to the ENT, and, but they were talking about the link between these kids who don't get adequate oxygen when they sleep, they're not developing properly, and they were linking it to the increase in diagnosis for ADHD. If you're not sleeping properly, you're not gonna behave in class, and they're also not developing properly. So we've been referring a lot of children, not necessarily for sleep studies, but to just have the tonsils evaluated, so.
That's awesome, that's a great place to start. Laura had a patient the other day that was the same, similar story, bedwetting, you know, a lot of things that she was just like in tears with the parents. Do you want to tell that real quick, or?
Well, I think that's really important to know what questions to ask. I had a young child, 8-year-old, in my chair, and same thing. I could just, you can't see their airway because we do tour. That's why we like everybody get in the habit of taking the tour, and then taking their airway. And you know, I had the sister who could totally see her entire airway, and then I had her younger brother, who's 8, couldn't even get. He's completely occluded and narrow. You know, getting that point ready for ortho, but you know, of course, so the parents comes in and he's on ADHD medications, and I look at the dad and I said, like, I excuse myself out loud and I say, does he wet the bed? And he's like, my house is flooded. And I literally wanted to cry. He's like angry. He's like, you don't know how many fights we have about. So I was like, well, it may not be his fault. And a lot of males get kind of targeted for that. They say that males, you know, bed wet, and we're finding out that 80 to 90% of it is actually lack of oxygen. So because they have a lack of oxygen, and so we see it then in older males, right? So that is like a #1 question to ask. I always ask older gentlemen over the age of 40, right, are you waking up at the same time every night having to go to the bathroom? That is one of the signs. So it's very interesting with lack of oxygen that, right, our urine builds up because our body's supposed to be shutting down, and because it's not shutting down and it's working really hard, it's actually producing urine when it's not supposed to be. And so then those children, by the time they fall asleep, they finally get to sleep, or they're so exhausted, their body doesn't arouse when they have to go to the bathroom because it's been aroused so many times. Like for oxygen, that's a higher on our scale, right? Our body will wait for that and then not wait for something else.
Right.
So there's actually, Daniel's doctor's wife is going, Dr. Xray, there's a great appliance that maybe we'll bring up. It's called the DNA appliance. And it actually is more of a solution rather than what I call a Band-Aid that people are doing. I really believe that occlusal guards and different appliances, you know, they're really a Band-Aid. They're not solving the problem. They're not preventing you from sleep apnea, where the DNA appliance is literally changing the anatomy. So it's opening, it's ortho and sleep combined. It's a very interesting, maybe we'll show one of those videos sometime, but if you have a chance to look it up.
DNA appliance. So how important are we? I mean, that's wonderful that you guys are, you know, picking up on these children, and this just to screen for this. Sleep apnea is killing a lot of people. People are waking up dead, and so that is so awesome that we can do that. So I don't know if you're using a form, you know, to ask these questions from your adults. You're seeing children, you're seeing art, and taking the intraoral photos to see if we have these. People in these classes not being able to breathe, so it's awesome to be able to do that and be doing that. So the next thing that we do is what I gave you there about the period disease, the laminate. We call it the laminate, period disease laminate. And the main thing that we want to have happen with that is self-diagnosis. We want a patient to understand before you do a period chart what we're actually doing and what the results of that charting is. So to do some sort of a real quick, we say it can't be over 3 minutes, because if it is, then you'll be like, okay, I don't have time to do that, and so you won't do it. But does anybody have something like this that they use consistently? Okay. So what about you guys? Do you? Okay. So the whole point of the laminate is to have the patient self-diagnose. We use the GPCS, which is a technique of presentation that I'll just run through real quickly because we'll talk about that at another step. And then just basically the patient understanding their disease well enough to accept the treatment and come back for treatment. So in this laminate, what we teach people to do is to use the pictures. We want to keep it really simple. So there's a few things actually that we, the guidelines, and that is it has to be done before your period chart so that the patient can actually diagnose themselves. We don't want it to be over 2 to 3 minutes. Have the patient hold the chart themselves so that they're more engaged. And then we have an introduction to the laminate, that what you're gonna do and why, and tell them that to start with. Then use each picture to keep it simple, and then give a summary. So on this picture, when I do this, I say, today we're going to be checking your gum tissue to see if you have any inflammation. We'll go around every tooth in 6 places. So we're going to take this little instrument that has millimeters marked on it. It's like a ruler. And in a healthy mouth, when we measure from the top of the gum to the top of the bone, it's 1, 2, or 3 millimeters. It doesn't bleed. If you look at this picture, the picture would be the gum tissue looks nice and pink and healthy. And when we look at your X-ray, we see there's no bone loss. So that's just a real healthy mouth. If maybe you haven't had your teeth cleaned, or maybe you're not doing what you should do at home, you might start to get some inflammation around your teeth. So when you measure from the top of the gum to the top of the bone in this level of disease, you're probably still going to get 1, 2, or 3 millimeters, but this tissue would bleed. Your gum tissue would look really red and bleed easily, but when we look at your X-ray, we still see that there's no bone loss. If you get your teeth clean and start to clean them really well every day, again, at home, this will go back to a really healthy state. If you don't stop it at this point, then we move into the level of disease. It's what's called slight periodontitis. And when we measure the pocket in slight periodontitis, it'll measure from the top of the gum to the top of the bone about 4 millimeters. The gum tissue is very red, swollen. You may have some recession starting to happen. And when we look at your X-rays, we'll see that this bone level has dropped down 1 to 2 millimeters. In moderate periodontitis, the pocket may be 5 millimeters deep. The tissue is even more inflamed. This patient probably has a bad taste and a bad odor in his mouth. And when we look at the X-ray, we can see that the bone, again, has dropped maybe another couple of millimeters, so maybe 4 or 5 millimeters. In advanced periodontitis, the pocket may be 5, 6 millimeters deep. The tissue is very inflamed. And when we look at the X-ray, we can see that the bone has dropped down probably at least 5, maybe 6 millimeters, maybe more. These teeth are probably loose, and this patient is very ill. So we don't want you to be down here. Hopefully we will find you up in this area. But if you do hear 4 or 5, don't panic. Together we can get you healthier. So that's the way I go through the laminate. And then I ask, what questions do you have about periodontal disease? And so usually they say, none. That's good. I understand. I don't want to look at it anymore. But you know what? If they do hear a 4 or 5, they do sort of panic. You know, they do kind of come out of the chair like, oh my gosh, because what are they doing in their mind? Hopefully, if we presented it well, they're seeing that picture and they know, wow. And sometimes I say that's when the truth comes out. They'll kind of go, yeah, that bleeds a little bit up there sometimes. You know, it's like, man, my gums don't bleed, but then when you actually get to that point. And then sometimes most of the time I'll say, what level do you think you would be? What level do you think you would fall? And that, again, that's when the truth comes out. I feel like sometimes they'll say, well, I might be right here, because sometimes it does bleed a little bit. You know, so I think going through the laminate is really great visual, and it gets them on board to be able to self-diagnose. Then the other thing that we do for time management and for clarity and for value is we use the GPS method of presenting treatment. So we want to always tell them something good, the G, what the actual problem is, what the consequence of not being treated is, and what the solution could be. The consequence is what we as dental professionals have a real hard time with. We can tell them all day long something good, we can tell them what the exact problem is, and we can tell them how we can fix it. But we tend to leave this out, which is the biggest reason that they come back. And a lot of times our patients go to the front desk and the lady will say, did you want to schedule your crown today? And the patient will say, well, I don't really have a problem with that. They just want to do a crown. Can I do it next time I come in? Because they don't understand that consequence. That consequence is not real clear. So we always want to use those words And so in this picture, if this was the picture of your patient's tooth, we would say, you know, what's good about this tooth is that you have great bone and tissue around the tooth. The problem is you have an infection in this tooth. There's a very large filling that's broken down. It's not sealing the tooth off. And the tooth, it's so large, the tooth walls are very thin. The consequence of not getting this fixed is that the infection will get bigger, will get worse, and you could actually break part of the tooth off. The solution for that is to remove the decay, put in a nice new filling, and then cover that whole tooth with a crown to strengthen it. So what we want the patient to be able to do is leave the office and go tell somebody that story. Well, it was really good that I have good teeth, I have good bone and tissue around the tooth, but I have this really old big filling that's not doing the job, and so I'm getting decay under there, or I'm getting my infection, my tooth is getting worse. And so what they want to do is take that infection out, put in a new filling, and then cover it to protect it. I don't know how many times our patients can actually go home and tell a story like that. I'm not sure. I think they leave more confused than that. So with this laminate, what we like to do is we make the intraoral picture, show them their pictures, but then also then go to this chart and ask them again, where if you're looking at your picture there up on the screen, where do you think you fall? So where do you think that patient would say he falls on that chart? We would go through it at some point and say, a healthy tooth, the enamel is all intact, the tooth looks really pretty like this with just some little grooves, and then when we look at your x-ray, we don't see any dark spots. If you have an early infection, we have a little spot in the enamel, maybe it hasn't gone through to the dentin yet, it's early, maybe you have a small filling there, or maybe we actually see a little hole. And when we look at your x-ray, we do see a dark spot on your x-ray. In moderate infection, we do see that that hole has gotten bigger, the infection has gotten into the inside, the softer part of your tooth. We could probably see a break or a hole or a shadow there in the tooth. Shadow, maybe there's a filling there, but when we look at the x-ray, we can definitely see some decay on the x-ray. In advanced infection, in the advanced infection, the hole has gotten so big that it's actually into the root, into the nerve of the tooth. There's probably a section of the tooth missing, or you have a really large filling that's not sealing off the tooth, and there's infection getting under there. And when we look at the x-ray, we may even see that that infection is bigger than it looks on your tooth. The unrestorable stage is when, unfortunately, the whole nerve of the tooth has gotten infected. You may have an abscess. Part of the tooth may be missing. There may be a huge crack in the tooth. And when we look at the x-ray, we can see that there's a whole lot of decay. It's gotten into the root of the tooth. There's infection, and we can't actually save the tooth at that time. Does anybody do this? Do you present and show what a good filling is and what? Okay. So where do you think this patient would say from that picture? Where do you think he would put himself? He'd say, I'm pretty advanced. And it's pretty easy to see that that picture looks a lot like the one that he came out actually out of his own mouth. Now, I guess we can't play the video. They aren't working. I really wanted to play this with one of our assistants. Time left anyway. But you can't hear.
I told you that happened last time.
There's a little bit of decay underneath existing.
Okay.
Feeling all done for you today. How's that feel for you? Feels good. Good. Okay, so there's something I need to review with you. Doctor has a goal for you on the upper right is one cusp there. Okay. The consequence is you can break off the remaining part of the cusp, but that's in case you get into the nerve of your tooth, cause you pain. Okay. Our solution is we would do a build-up and a crown on that too. Okay. Do you have any questions? The other one down there, I know how to have a root canal. Is that one going to need a root canal also? It's hard to tell at this time because we don't know the decay is into the nerve. The good news is you're not having any sensitivity, correct? And I think we caught it early enough to where if we get it done sooner than later, then we can get it taken care of for you. Okay? Okay? All right. Thank you. How long was that?
How long was that?
So that's the restorative side. I want to kind of clarify that. Our assistants.
So you just pick the worst couple spots and show them that, and then go over the chart? It's real easy. It seems real easy to me if I got one tooth I want to show them, picture X-ray, then go over, but what about when I've got an entire quad or an entire mouth?
Then you go through
Yes.
all your photos, but then you're gonna highlight one that you would think would be the primary, right, and do
Okay.
your problem consequence. But we really hand the laminate to them after the photos and say, you know, I just want you to use this as reference. Take a look at your picture, and where would you place your teeth on the chart? Because you really want to click. Now, if it's like a new patient, and you have the time, then that's what they're doing. They're actually taking the time to go through it. But just in the everyday, you're just handing them that, and that's what we tell the patient. We just want you to use this as a reference when you're looking at your teeth. And then we want them to make the diagnosis themselves. So they're like, oh my gosh, yeah, I'm advanced or I'm moderate. Most patients put their teeth in a worse category than maybe you would. And it's very interesting. So they're at that moment when they say, yes, I'm advanced, or it's at least moderate here, I need to do something, they're already saying yes to you, and you really haven't even told them what we say the problem, consequence, solution, what the solution is. So that's the idea behind it.
Okay, so what we were gonna do is break up into groups and practice, so we'd love for you guys to just practice if you want with each other, just like pair up and go through your perio laminate and also your restorative laminate. Just practice what you would say to your patients to do that. And I also want to just say really quick, January, our next meeting is January 5th, and that'll be on step 5. It's all about classification of disease, periodontal disease, by the AAP, and so we'll be looking forward to seeing you guys there. And your CE certificate is in your package, so. Oh, the calendar's not right. That's just a picture. Yeah, it's a Thursday. Yeah.